analysis derived from the KarMMa trial, which evaluated the Idecabtagene BB2121 in patients with relapsed refractory multiple myeloma, which is an anti-BCMA-targeted CAR T-cell therapy. As a background, those patients included in this trial had a median of 6 lines of prior chemotherapy, with at least 3 lines of chemotherapy to be eligible for this trial. So if this is reflective of anything, it would be reflective of a poor quality of life with lots of treatments. And as known, multiple myeloma patients unfortunately have the highest symptom burden across all hematologic malignancies. So in this analysis, investigators did apply prospectively the ERTC QLQC30 and the multiple myeloma 20, which are 30 and 20 questions respectively, evaluating domains of physical, cognitive, global health, and multiple myeloma symptoms and side effects of treatment to recipients of anti-BCMA-targeted CAR T-cell therapy. And interestingly, according to the reported results before and after treatment at month 9 as a landmark, all symptoms, including fatigue, pain, physical functioning, global health, cognitive functioning, disease symptoms, all improved considerably before and after the treatment. And if this reflects anything, it will be reflective of the efficacy of the treatment in alleviating symptoms, and also it might be reflective of the nature of the treatment itself, which is one-time treatment that does not require follow-up treatments. And if this is to be applicable to our patient population, where we often see patients from far from the center, the tertiary center, that might also be a good option for these patients who doesn't need to come so often to receive chemotherapy or have follow-up blood results or bone marrow aspirate and biopsies. And I think this treatment has lots of potential from that perspective, and this probably is the best presented data so far evaluating quality of life in patients receiving CAR T-cell therapy in general.